Hi everybody. Today I want to talk to you about something that's a little bit different from what we've been focusing on recently. And that is that with the quarantine and the isolation that we're all being subjected to currently, a lot of people are really suffering from, depression, anxiety, and PTSD. And I just wanted to address that there are things that can be done about this. We have had a lot of success with low-dose ketamine infusion. There's a lot of scientific data behind that intervention for these types of issues. So if you're finding that your mental health is suffering because of the isolation, know that there are ways to address that. Please reach out if you need help. And I'm going to go over some the scientific data behind how ketamine can really benefit people in these kinds of scenarios. If you want to keep watching, of course. I'm just going to go over a few articles. There's really no reason to go really in depth because there's a number of studies, but have been repeated for over a decade now, demonstrating how ketamine can be effective for long-term suppression of treatment-resistant depression, anxiety disorder, and PTSD. What we've seen with a lot of our clients is that the effects of this, the beneficial effects of low-dose ketamine infusion can happen very quickly, almost immediately for some people, meaning they leave the office a different person than when they came in, feeling better, with their symptoms under control, able to go back to functioning and feeling the way they really want to be functioning and feeling. But here's just a little bit of data beyond our anecdotal experience with it. This is in the Indian Journal of Psychiatry, which I threw in there really just to show that this is cross-cultural. This isn't isolated to a specific region or specific type of depression. So ketamine had robust and rapid effect on depression, which was seen immediately after the administration of ketamine and sustained at the end of a month. This is pretty typical for what we see for our clients in the office who do these infusions. Journal of Psychopharmacology. This is for treatment refractory generalized anxiety and social anxiety disorders. But they did weekly ketamine dosing. We have a protocol that's a little bit different from what some of these papers go through, but that we've had a lot of success with. And to cut to the chase here, patients reported marked improvements in functionality and in their personal lives. And then another one for anxiety, just to give you a graphic. This is a scale of anxiety. The higher on the scale you are, the worse the anxiety is. You'll see the placebo arm in this study, started here, stayed right around where they started, whereas the ketamine group started worse based on the scale and had significant reduction in symptoms that was prolonged. And then finally for PTSD, and this is, Journal of American Medical Association Psychiatry. This is a high-powered journal. This was one of the first controlled trials for PTSD. And there were other cohort studies that weren't quite as robust in the way they did the studies, but this one, was done in 2014. And it really shows, rapid reduction of symptoms, severity, following ketamine infusion for patients with chronic PTSD. And they say, of course, this needs to be replicated again and in broader studies. But there is robust data for ketamine in these disorders. I feel that it is an underutilized therapy because it's not well understood by the people who usually treat these disorders. I just want you to know that if you're feeling overwhelmed or if you feel like things are out of control because of how you're feeling related to this social isolation, there are things you can do that can give you rapid results and aren't going to, land you addicted to some medication over the long term. Most of the people that we give low-dose ketamine infusions to get a series of, 2 or 3 up front, and then we'll often space that out, say, let's see how you feel in a month. But most people after that initial series will go months without needing another infusion. So know that there is hope, there's something you can do, and reach out if you need help.